When the kids are babies, sleepless nights are just part of the deal. But that exhaustion endures for those who share a bedroom with someone who snores. You might not think to discuss that issue when you're getting your teeth cleaned, but there's actually a good reason to talk about your sleep habits at the dentist's office.
He started snoring, and then that got gradually worse.
But Becky Freischmidt also suspected her husband Steve had sleep apnea as well.
He would go for so long without taking a breath. It was scary. I could nudge him and he'd take a couple breaths and he would do the same thing. It was all night long.
And she never expected to get help from her dentist.
The only reason why I think I did say something is because he had something up in his office about snoring.
Officially, sleep apnea is if you stop breathing more than 5 times every hour when you're sleeping. And what happens is when you're sleeping at night, the weight of the mandible and the musculature settles, and as it settles, that musculature closes the airway, and you literally stop breathing.
I was worried because I knew obviously that's not healthy.
That's why Dr. Dukaman suggested a one-night at-home sleep study to learn more about what happened to Steve at night.
All the objective data is there. It measures 8 hours of your sleep, and it tells you exactly how many times per hour you stop breathing, and it measures snoring, and it measures what position you're sleeping in. It tells us all of the data of your whole sleep event.
And they were as long as 36-second episodes that he had where he didn't breathe. It's a long time.
The number one line of defense is a CPAP machine. They fit over either just your nose or your nose and mouth. They've got straps around your head so they can hold the mask tightly to your face. And it's constantly pushing pressure into your mouth and nose to keep the airways inflated so that you can actually breathe all night long.
I looked into it and I knew I wouldn't be able to handle that.
For those who can't tolerate a CPAP, there is now an alternative, a small appliance worn in the mouth while you sleep, called a mandibular repositioning appliance.
It's got a lower component to it and an upper component to it, and so you basically just slide it in and close into it. And then it's got these arm components on both sides. And what the arm components do is they hold the mandible slightly forward when you're sleeping. And that doesn't allow the mandible or the tongue or any of that musculature to fall on the airway. And it'll keep your airway open all night. You'll sleep like you haven't slept in a long, long time.
I felt better. I felt more rested, and it's immediate.
It's amazing to me when the spouse calls the next morning and says, "Oh my gosh."
Amazing. I mean, it was incredible. I couldn't believe it the first night he had it in.
And that is the amazing life changer. Not only a life changer, but a life saver. When you do stop breathing, your body starts dying. And your blood pressure skyrockets over 200. This is the point in time where people have heart attacks and have strokes.
It was a game changer.